So the ASPEN is a randomized study between Zanubrutinib and Ibrutinib, and my colleague, Professor Demopoulos, updated the long-term outcome of that study, which continued to show that Zanubrutinib was better in terms of safety, with a signal to perhaps improve efficacy as well. My specific abstract was to talk about the genetic analysis of that study. So we did next generation sequencing using a highly sensitive assay, and we looked at all the different gene mutations between the two arms. Now, a few key points have emerged from the analysis which are novel. Firstly, we already know that CXCR4 is an important risk factor for patients with BTK inhibitor therapy, and the analysis that we have would suggest that Zanubrutinib is probably better than Ibrutinib in a CXCR4 mutated population. So that's a new finding. The second new finding is that P53 mutation, which, as we know, is very important for other diseases such as CLL and mantle cell lymphoma, is also turning out to be really important in patients with Waldenström's treated with BTK inhibitors. And if you have a P53 mutation and you take Ibrutinib, your results tend to be less good. And once again, in that setting, Zanubrutinib looked better than Ibrutinib. So we know broadly that the two drugs are both effective, but with the genetic analysis, we're starting to understand that maybe for the high-risk genetic groups, such as CXCR4 mutated or P53 mutated patients, that Zanubrutinib may in fact be a better drug.